someone asked me if I were to do medicine all over again, that would probably be one of the main reasons why I would choose not to. I spend almost as much time talking with health insurance companies as I do talking with my patients. Prednisone. I had a family who came in, the child had an acute asthma exacerbation with an immediate need for prednisone. She goes to the pharmacy with the prescription that I have been writing for the past 15 years, but for whatever reason, the insurance company decided that I needed to complete a prior authorization. So I sat on the phone for 30 minutes trying to get a pre-authorization. By the time I finished, the pharmacy was closed. So now this child has to go to the emergency department to get his second dose of prednisone. That's an insane amount of cost, just in terms of the emergency room visit, but also in terms of time, and it impacts me every single day. My support of a system like Medicare for All actually starts when I was a little girl. I watched my family suffer from having a lack of access to care growing up in a rural part of Louisiana. Being a Medicaid recipient myself as a child, I noticed early on the difference in care, and it's one of the reasons why I pursued a career in medicine. And I can completely see that there are two different healthcare systems if you have health insurance and if you don't. And here locally, when you look at Washington, D.C., if you are a Black woman living in Southeast D.C., you have a higher chance of dying during childbirth. I can actually tell a story about my own mother. We went to the hospital not too long ago. I was worried that she was having a stroke, and it wasn't until I pulled my doctor card that her care changed. I think that they saw her as a stereotypical overweight African-American woman who likely didn't have health insurance, and it wasn't until I went back in there with her and told them that I was a doctor that things changed. Even after that, my mom has received at least 15 different hospital bills from 10 different healthcare providers that saw her. I mean, it was insane. We still get hospital bills, and it was a month ago. And I'm like, you're billing for the gauze? Like, good grief. One of the important things that people have to realize is how much lack of insurance impacts them, even if it's not a direct impact. What you have to think about is the financial impact on the country as a whole. It isn't surprising that we spend the most money on healthcare but have some of the worst health outcomes compared to any other developed country. And I think it's a true reflection of how we see health. Health is seen as a business and not a right. And when we have something like Medicare for All, there's a shift in the energy and it becomes a right.